Hey guys, Starla back here with another installment of our Q&A. This is part 2, and we will be talking about autoimmune hepatitis, the medications involved, and how it applies to transplantation. Have my Q&As here. I'm actually reading. I'm not like ad-libbing here, so because it's just too much to do that. So part 2, what is autoimmune hepatitis? It is liver inflammation that occurs when your body's immune system turns against liver cells. The exact cause of autoimmune hepatitis is unclear, but genetic and environmental factors appear to interact over time in triggering the disease. Untreated autoimmune hepatitis can lead to scarring of the liver, which is cirrhosis, and eventually to liver failure. When diagnosed and treated early, however, autoimmune hepatitis often can be controlled with drugs that suppress the immune system. A liver transplant may be an option when autoimmune hepatitis doesn't respond to drug treatments or when liver disease is advanced. And I give you a link in the description to go over that a little bit more if you want to go deeper in your reading for that. How did you get it? My doctors say that I was born with it and didn't know it. I found out later, much later in my life, that I was born jaundice, which jaundice is when your I think it's when your bilirubin gets really high and you look yellow. Like right now I look yellow because of the yellow light, but like in jaundice babies, they look like dark yellow. They don't look white, fair, pink, flushed, whatever. It's yellow. There's no mistaking. And that's how I was born. Well, in the 80s, the early 80s, none of this stuff was known, so they just, thought, well, her liver is underdeveloped and she'll mature and, everything will be okay. Well, that's not what happened. Actually, it went the opposite way. My liver did mature, but that's not what was wrong with it. I had autoimmune hepatitis. It was actually also the cirrhosis was triggered or increased the disease in that when I was younger I was a partier. I drank and some things kind of like went bad for me for a few years, and I used it to cope, which I shouldn't have, obviously, but I did. And so I drank alcoholically for a couple years, and so that is actually what my doctors think gave me the cirrhosis at such a young age. But the drinking itself did not cause the autoimmune hepatitis. Drinking can't cause that. And that means like when people say or hear hepatitis, they think hep C. Okay, they think it's viral. Viral hepatitis is A, B, and C. And C is the most common because it can happen during sex or with drinking a lot, with intravenous drugs, like heroin, things like that. But it's not viral. It's just my body fighting against itself. It's not contagious or dangerous to anyone else. When and how were you diagnosed? It was diagnosed when my liver failed. That happened in January of 2012. It failed completely. I died in the ambulance and they brought me back. I think I referred to that little experience before, and I'm not going to go into that yet. It is an experience that I would love to tell you, because I do absolutely believe that there is life on the other side. Just because of what I experienced, I was dead and they brought me back, but that is not for today. So the diagnostic tests were the ANA blood titer, which will tell you whether or not you have an autoimmune disorder. That's just a general thing. And then they do a liver biopsy, which consists of them putting a needle, or like a hollow needle, into my liver tissue, cutting off some of it and pulling it back out, and like examining it under a microscope and doing all they got to do in a lab. So all of that came back positive for autoimmune hepatitis. And that was all in January 2012 when my liver failed. And that's actually when we knew that anything at all was wrong, because we had no idea. Things were happening, like I was having symptoms, but we didn't know what to look for, so we had no idea. Like, I was jaundiced again, really bad. Like, I was so jaundiced that I looked like a Simpsons character, and I'm not exaggerating. My scalp was orange. It was that bad. But, like I said, if you don't know what you're looking for, you're not going to find it. I was very bloated. I had fluid retention. None of my clothes fit. I was irritable. My bowel movements were different. I'm not going to go into that, but if you have a snake, or if you've ever seen a snake go to the bathroom, it looked like that. It was exactly like that. So you know that if you're pooping like a snake, it ain't normal. Sorry, little humor there. So yeah, that's when I was diagnosed, and that's how it all happened. I actually ended up first, I went to the JMC emergency room. Again, I will tell you, if you have something seriously wrong with you, don't go there, because they can't do anything for you. They're not equipped to. They will send you to Berkeley or Winchester, depending on your insurance. Now, because I didn't have any insurance then, they sent me to Winchester. And then Winchester, thinking it was my gallbladder, said they were going to do surgery. But then when my liver started, my liver was failing the entire time, but they couldn't figure out that it was my liver. Something happened at Winchester, which I don't know because I was out of it. I was there 3 days, and I only remember 10 minutes of it. So eventually they made the decision to send me to UVA in Charlottesville, Virginia, and that's where they made the diagnosis. And at that time, they wanted to put me on a transplant list, but they didn't do it because they didn't have health insurance. So if I had had insurance, I probably would have a brand new liver by now. So let that sink in, and then come back to me about our healthcare system being fair. Let's see, we won't go there though, not today. What are your treatment options? Immunosuppressant therapy, which is one of the options. It's different ones like azathioprine and Cellcept and tacrolimus and sirolimus, and what they are is anti-rejection drugs. So if you have a transplant, they give you these medications so that your body doesn't reject the organ or the blood that is transplanted into you. The same thing is used for autoimmune disorders, so that the immune system will stop attacking the organ or the rest of the body. The immunosuppressant therapy I was taking, azathioprine, is actually what gave me the MDS, which was covered in Part 1. Excuse me. Let's see. And then there's prednisone. Dun dun dun! This one should be there's whole books written about this medication. It is like a double-edged sword, okay? Prednisone is a corticosteroid that decreases the immune system while also eliminating inflammation in the body. Autoimmune disorders are inflammation. That is what they are. They're chronic inflammation. When given at the correct dose for the correct amount of time, this medication can work miracles, and it absolutely can. It is the only thing that brought me back from death. Once when I was diagnosed and I died and all that stuff, The only thing they gave me was prednisone, and it brought me back to the land of the living, basically. However, it is also a double-edged sword and can wreak havoc when not monitored properly or given properly. Now, these are just the side effects like before the other video. I'm going to list the side effects that I had, and then I'll give you a link to the rest of them, because it is so long. Like I said, books have been written about this, and mostly because of the side effects. Side effects I've experienced due to having an ignorant gastroenterologist who had limited knowledge and experience with my condition as well as the medications given. Now, he is no longer my doctor, and I will not tell you who it is, so don't ask. He just didn't have a lot of experience because I was only like his third patient with autoimmune hepatitis, and he was not well versed in this situation. So it wasn't completely his fault, and unfortunately my insurance, that was my only option, so I'm not blaming him. I'm just saying that's what happened. Okay, this is what I experienced. Aggression, agitation, anxiety, blurred vision, decrease in the amount of urine, dizziness, fast pounding, irregular heartbeat or pulse, headache, irritability, mood changes, noisy, rattling breathing, numbness or tingling in the arms or legs, shortness of breath, swelling of the lower legs, trouble thinking, trouble breathing at rest, weight gain, holy crap, weight gain, abdominal or stomach pain, backache, cough or hoarseness, darkening of the skin, decrease in height, decreased vision, dry mouth, eye pain, facial hair growth in females. That is not a joke, and do not laugh at women who have that problem, because it is terrible. Like, I don't have a lot of it, but I do have some. I mean, obviously I pluck it and I look for it because, you know, I mean, my hair is blonde and I'm fair, so it's not as obvious, but I feel so sorry for these women with dark hair that have like mustaches and, you know, like you can really see it. Don't ever laugh at them, because it is not their fault, and it sucks to be on this medicine anyway, but to deal with that too, I would smack you if I saw you laughing at somebody like that, because that's just wrong. Where was I? Fever or chills, flushed dry skin, fractures, and I have a permanent, well, I don't know if it's permanent, but I do have a fracture on my second toe on my right foot where my German Shepherd had stepped on me, and I want to say that it's crushed, and I've never got it taken care of because it was never really a problem. It only bugs me sometimes, but I'm thinking they'll probably deal with that during the next transplant testing, because they do like bone density tests and all that stuff. But I've had this since like 2013, and it came from being on that prednisone and getting stepped on by an 85-pound dog. Let's see, fractures. Full or round face, neck, or trunk. They call this the moon face. And right now, if you notice in my earlier videos, I had like this little turkey neck thing going on because I was losing so much weight, and it was skin and it had nowhere to go. Well, now you can see that I'm slowly starting to lose that, and it's because my face is filling out more, and it will eventually take on the appearance of a crescent moon. Like, I don't know if the amount or the dosage I'm on will be so pronounced as it was before, but you can see, like, how it's kind of going away. Yeah, well, that's why. It's because of the prednisone. Eventually, it'll just look like I'm fat in my neck, which sucks, but whatever. But that's why. They also call it Cushing's Gold Syndrome or appearance, and I'll put a link and you can read about it. heartburn or indigestion, severe and continuous. This stuff rivals actual GERD. And if you've ever heard of GERD, it's like it can mimic a heart attack like that. And it will be continuous and like pain. You got a rock in your chest, you got a rock in your back. You can't lay down because like you feel the acid rising, or it just hurts and you can't rest. And I can't even describe to you what kind of torture that is. And you get that with this medication. It's very common. So if you're on prednisone, or you're thinking about it, or you've been prescribed, make sure you eat a full meal with that medication, because if you eat it on an empty stomach, that will happen. And it is terrible. There's still a chance it might happen anyway, but I'm just saying, eating helps. Increased hunger, and it's not just increased hunger, it's increased hunger for junk. Like, you want carbs, you want comfort food like pasta and sugar and like sweets. Oh my gosh, I am so addicted to, my cousin's kids are selling those $1 candy bars, and I am addicted to the caramel ones, and I ate so many of them that I actually made myself sick. Like, I ate so many in one sitting, I actually vomited. Because it was like, I wasn't hungry, I didn't want them, really, that wasn't me, I don't eat chocolate like that, but the prednisone, it just makes you want to eat and eat and eat and eat and never stop. Most nights, I have to decide, do I want to go to sleep or do I want to eat? Because I'm always hungry, it never goes away. You might feel full for like a half hour, maybe an hour, and then you're hungry again. And it's never for good food. It's always for junk. And that's how you gain the weight. Increased thirst. My bottled water, I drink water like it's going out of style anyway, only because I have to. And I've actually trained my taste buds to prefer it. But on prednisone, I double it. Like, if I drink, say, 5 of these a day, on prednisone, I'll drink 10. It's like, I mean, that's just an example, but you see my point. It's that bad. Increased urination, obviously, because you're eating and drinking more and all that stuff. Increased appetite, we've already done that. Loss of sexual desire or ability. Oh my God. I don't need to explain that. That's self-explanatory, and that sucks. Just period. That just sucks. It's awful, especially if you're married. I'm lucky. I'm single. I'm not married. You know, I don't have to worry about that. But when I was married, it really caused an issue because you just don't want it. Just point blank. You could live the rest of your life and not even worry about it. You don't think about it. You see stuff on TV like love scenes on movies. It doesn't affect you. It's like you're asexual. You don't care. And it's like, really? Like, am I even human anymore? I don't even want to have sex. So, let's see. Lower back pain, side pain, menstrual irregularities. There was a point where I just stopped, which for me, I don't need it anymore anyway, so it really doesn't matter as long as it's not like unhealthy for me. But yeah, if you're trying to have a baby or you're of that age, depending on what doses you are, they're going to stop. Or they're just going to be really light. Or they'll be light and then they'll be heavy, and don't let it freak you out, okay? I mean, go to your doctor and all that, but just don't freak out. It happens. Muscle pain or tenderness. Muscle wasting or weakness, and nausea. Muscle wasting, I have that problem. I have to exercise, or like I can literally feel like my muscles just hurt from lack of use. And that's scary, because it's, I guess it's called what? Necrosis, when they start to die, and that's possible. It's happened to people on prednisone for a long time. It's bad. pain in the back, ribs, arms, or legs, skin rash, sweating, trouble healing, trouble sleeping, unusual tiredness or weakness, vision changes, vomiting, abnormal fat deposits on the face, neck, and trunk. That's what we were talking about, the moon face and all that. Acne, like crazy, dry scalp, lightening of normal skin color, red face, reddish purple lines on the arms, face, legs, trunk, or groin, which I think I only ever had those on my legs and my arms, but it's like stretch marks and they never go away. I mean, the purple color goes away, but the stretch marks themselves never go away. They might shrink, but you're gonna have them forever. Swelling of the stomach area, which it makes you look pregnant, and when you get like stuff like, it will give you Cushing syndrome, which means like all your fat distribution is all out of whack. So you look like you're pregnant, or like you're a pregnant monster. It's terrible. Thinning of the scalp hair. You lose your hair. That's just, I mean, it's like chemotherapy almost. And the general information about it is, it says, this is from drugs.com for the physician's end of it. It says, the most commonly reported adverse effects associated with corticosteroid use include fluid retention, alternation in glucose tolerance, high blood pressure, behavior and mood changes, increased appetite, and weight gain. And that's it in a nutshell. That's the absolute worst. And I'll put a link there for the side effects for that too. Is there a cure? There is absolutely no scientifically proven cure for any autoimmune disorder. None of them. Particularly autoimmune hepatitis with cirrhosis. Your liver can regenerate itself if you have fibrosis, which is scarring, like light scarring on your liver. But once it gets to stage 4 fibrosis, it turns into cirrhosis, and there is no reversing it. It will forever be hardened, tough tissue, and it doesn't reverse itself. And it gets cirrhotic because when it's like fibrosis, it will attempt to repair itself, and because it's sick, it can't do so properly. So then it gets cirrhotic and basically dies. My liver, because it's cirrhotic, is smaller than other people's livers, but because of the inflammation of the autoimmune disorder, it's swollen, so it appears and feels larger to my doctors and in scans and things like that. Excuse me. I can manage the autoimmune disorder with special diet and exercise, as well as medication. And there are alternative medical physicians who claim the immunity dysfunction can be reversed with diet, but that's up in the air. Like I said, there's no scientific proof to say that either way. I'm sure there are foods that you can eat, and there are exercises you can do to help the situation. Obviously, eating greens and like your vegetables and fruits and stuff is a lot better than eating pies and cakes and cookies and candy. I mean, obviously. But no, there is no cure for cirrhosis. The only thing that I could do would be to get a transplant. What is your prognosis? With no treatment, meaning no medications, my liver would fail and I'd be dead in a couple days. Immunosuppressant therapy prevents the immune system from attacking the liver, though it carries its own risk of a lower immune system, making it difficult to fight off infection. So that would be a treatment or whatever. Why is that in there? The medication I am currently on is prednisone, which I just went down through all those side effects, which has an even longer list of negative side effects than what I've already listed. Rather than recite all of them, I'll just, yeah, I already did all of that stuff. So why is that in here? I messed that up. Now, my prognosis. Although I have cirrhosis, my liver functions normally, which means I'm not sick enough and don't qualify for a liver transplant by itself. There's no, there's called a portal vein in the middle of the liver, which is where the blood flows, and that has never been blocked. It's not blocked now, and it doesn't look like it will be in the future. So when that gets blocked, that's usually when you have to have a transplant, but so far, so good. I've never had that problem. Because we are going forward with the stem cell transplant to cure the blood cancer, I could have a liver transplant following that procedure if my liver should fail. However, I need a living donor because although I would be in active liver failure, I wouldn't be high enough on the transplant list to obtain a cadaver liver, which is, you know, a cadaver being a dead person, in time to save my life. It sounds horrific to cut a lobe off of a living person's liver to give to a dying patient, but our livers regenerate and take about 6 weeks to grow back in a healthy individual. Because I have no siblings and both of my parents are too old, finding a living donor or a living liver donor has been hell. That alone could prevent me from having the life-saving stem cell transplant. My liver is the biggest issue in the entire process. So that's part 2. I'm sorry it's so long, it's almost 30 minutes, but that was a lot. And I will hit you with part 3, which is basically like general information that I've been asked other than the medical stuff. So if you have a question, just put it in the comments here or on my Facebook or Instagram or wherever you follow me, and I'll get to it in a future video. So hope you guys have a good night, and don't forget to subscribe. Thanks. Bye-bye.